Every single day, millions of people over 50 are unknowingly allowing a biological process inside their body to quietly escalate into one of the leading drivers of cancer. And the habit that is making it worse is something most people consider completely harmless. In fact, many older adults believe they are doing the right thing for their health while this process silently accelerates. What I am about to share with you is not a theory. It is not a trend. It is one of the most consistently supported findings in cancer research over the last 2 decades, and it involves something you do every single day, multiple times a day, without thinking about it. My name is Dr. Alan Mandell, and I have spent decades studying and treating patients facing cancer diagnoses. What I have seen again and again, what keeps appearing in the research, and what I wish more people over 50 understood clearly, is that cancer rarely appears without warning. The body sends signals for years before a diagnosis arrives. And in many cases, the daily habits of older adults are either fueling that process or stopping it before it ever reaches a dangerous stage. I want to tell you about a patient I will call Margaret. She was 63 years old, active, health conscious, and proud of how she was managing her age. She ate reasonably well. She took her supplements. She walked her neighborhood most mornings. By most definitions, she was doing everything right. But when her diagnosis came, her oncologist noticed something in her metabolic blood work that had been quietly present for years. Her inflammation markers, specifically her CRP, which stands for C-reactive protein and is one of the body's most measurable signals of internal stress, had been elevated for a long time. Nobody had connected it to cancer risk. Nobody had asked her about the one daily habit that was continuously feeding that inflammation. That is exactly what I want to explain to you today. Because what the research now tells us, confirmed in studies from institutions like Harvard, Stanford, and the National Cancer Institute, is that chronic low-grade inflammation is one of the central biological environments in which many cancers develop, spread, and become harder to treat. And there is one habit, one behavior that adults over 50 perform routinely that researchers have identified as a powerful and consistent driver of that inflammatory state. The good news, and I want you to hold on to this as we go through today's video, is that this habit is modifiable. It is something you can change today, and the research suggests that making this single change can measurably shift the biological environment inside your body away from one that supports cancer growth and toward one that actively resists it. But before I explain what that habit is, you need to understand why the body becomes so vulnerable to cancer after 50 in the first place. Because without that understanding, the action step will not make complete sense. After 50, the body undergoes a series of biological shifts that most people never fully understand. The immune system, which spent decades identifying and destroying abnormal cells before they could multiply, begins to lose some of its precision. Natural killer cells, the immune system's specialized cancer-destroying units, become less responsive. Cellular repair mechanisms slow down. And perhaps most significantly, the body's internal inflammatory response, which is designed to activate briefly during injury or infection and then switch off, begins to behave differently. In younger bodies, inflammation is a controlled event. Something triggers it, the body responds, the threat resolves, and inflammation quiets down. But in adults over 50, particularly those with certain lifestyle habits, that off switch becomes unreliable. Inflammation does not fully resolve. It lingers at a low level day after day, month after month, sometimes for years. Researchers call this chronic low-grade inflammation. Some scientists have given it a more descriptive name that I find useful for patients, inflammaging. It is the combination of inflammation and aging, and it describes exactly what is happening inside the bodies of millions of older adults right now without any visible symptoms. Here is why this matters for cancer specifically. Tumor cells do not grow in a vacuum. They grow inside a biological environment, and that environment either makes it easier or harder for cancer to take hold. A 2019 study published in the journal Nature Reviews Cancer found that chronic inflammatory environments actively support tumor formation by promoting abnormal cell growth, suppressing immune recognition, and helping cancer cells evade the body's natural defenses. In simple terms, persistent inflammation creates the biological conditions that cancer needs to develop. And the habit I mentioned, the one that so many adults over 50 perform every single day, is one of the most well-documented triggers of exactly this kind of persistent internal inflammation. Most people assume inflammation is something they would feel: pain, swelling, redness, heat. But chronic low-grade inflammation produces almost none of those visible signs. It operates silently in the bloodstream, in the tissue lining of organs, in the gut, in the vascular system. By the time it becomes visible, it has often already done years of cumulative biological damage. This is where things become more dangerous than most people realize. The habit at the center of today's discussion is prolonged sitting, and the research connecting sedentary behavior to cancer risk in adults over 50 is among the most consistent findings in modern oncology and preventive medicine. Before you dismiss this, I want you to understand what the science actually shows, because this goes far beyond general fitness advice. This is a direct biological mechanism that has been studied, measured, and confirmed across multiple large-scale trials. A landmark study published in the Journal of the National Cancer Institute followed more than 68,000 adults and found that those who spent the most time sitting each day had significantly elevated risk for colon cancer, endometrial cancer, and lung cancer, even when accounting for the amount of exercise they performed at other points in the day. That final detail is the one most people miss entirely. Even regular exercise could not fully counteract the cancer-promoting biological effects of extended, uninterrupted sitting. What happens inside the body during prolonged sitting is a cascade of measurable physiological events. Muscle activity drops to near zero. Circulation in the lower body slows dramatically. Blood glucose regulation becomes impaired because the large muscle groups in the legs, which normally absorb glucose from the bloodstream and help regulate insulin, go completely inactive. Over time, this creates a state of insulin resistance where the body must produce more and more insulin to manage blood sugar. And elevated insulin and its companion molecule IGF-1, which stands for insulin-like growth factor, have been shown in repeated studies to directly stimulate the growth of cancer cells. At the same time, lipoprotein lipase, an enzyme that plays an important role in fat metabolism, drops sharply during prolonged sitting. This contributes to the kind of metabolic dysfunction that researchers now recognize as a consistent background condition in many cancer patients. Here is the practical warning most seniors are never told. The research suggests it is not just total daily sitting time that matters. It is the uninterrupted duration of each sitting period. Sitting for 3 hours straight appears to produce measurably different metabolic consequences than sitting for 30 minutes at a time with regular breaks in between. But what happens to the immune system during this process is where things become truly alarming. The immune system's ability to detect and destroy abnormal cells is not a passive process. It requires active biological conditions to function at its highest level. And one of the most important of those conditions is consistent physical movement. When the body moves, even at low intensity, it triggers the circulation of immune cells throughout the bloodstream and lymphatic system. Natural killer cells, the immune system's frontline defense against early-stage cancer cells, are mobilized and distributed across the body's tissues. Inflammatory cytokines, which are chemical messengers that regulate immune response, are kept in better balance. The entire immune surveillance system, which is responsible for identifying cells that are dividing abnormally and eliminating them before they become tumors, operates more effectively in a body that is regularly moving. During extended sitting, this circulation slows. Immune cells become less efficiently distributed. The lymphatic system, which unlike the cardiovascular system has no pump of its own and depends entirely on muscle movement to circulate fluid, becomes sluggish. Waste products and inflammatory compounds that should be cleared from tissues accumulate instead. A 2020 study conducted by researchers at the University of California, San Diego, followed over 5,000 women over the age of 60 and found that those in the highest quartile of daily sedentary time had a 65% higher risk of developing cancer compared to those who sat the least. The researchers specifically noted that the relationship remained statistically significant after controlling for exercise habits, body weight, and smoking history. What this tells us is that sedentary behavior is not simply the absence of exercise. It is its own independent biological risk factor. It creates its own unique set of internal conditions, separate from what exercise does or does not counteract. Now, the research also points to something that is both alarming and deeply hopeful. The biological damage from chronic sedentary behavior is not sudden. It builds gradually. But the biological response to movement, even modest and regular movement, is also measurable within weeks of beginning a consistent routine. Before I explain exactly what the research recommends, there is a second physiological mechanism that most seniors are never told about, and it may be even more important than circulation. The relationship between the gut and cancer is one of the most rapidly expanding areas of modern oncology, and what researchers are now discovering about how sedentary behavior affects the gut microbiome is changing the way cancer prevention is understood. Inside the human digestive system live trillions of microorganisms, bacteria, fungi, and other microbial life that collectively form what scientists call the gut microbiome. This internal ecosystem plays a direct role in regulating immune function, managing inflammation, producing compounds that influence cell growth and repair, and even determining how effectively the body neutralizes cancer-promoting substances before they reach vulnerable tissues. Research published in the journal Cell in 2022 found that the diversity and composition of the gut microbiome is directly associated with cancer susceptibility and treatment outcomes. People with healthier, more diverse gut bacterial communities showed stronger immune responses to early abnormal cell activity, lower systemic inflammation, and better regulation of IGF-1 and other growth factors that cancer cells depend on. Here's what most people over 50 have never been told. Prolonged sedentary behavior measurably disrupts gut microbiome diversity. A study from the University of Illinois found that just 6 weeks of increased physical movement, specifically regular low-intensity activity throughout the day, produced measurable positive changes in gut bacterial populations, including increased levels of bacteria that produce butyrate, a short-chain fatty acid that has direct anti-tumor properties in the colon. When adults sit for extended, uninterrupted periods, gut motility slows, transit time for food and waste material increases, and the bacterial environment shifts toward compositions associated with higher inflammation and reduced immune surveillance. This means that every day a senior spends in prolonged, uninterrupted sitting is a day when the gut environment is being nudged slowly and silently in a direction that reduces the body's natural cancer defenses. And the consequences do not remain confined to the gut. They spread outward through the entire body, through the bloodstream, through inflammatory signaling pathways, reaching the liver, the lungs, the breast tissue, the prostate, and beyond. What happens at the cellular level during this process is something every adult over 50 deserves to understand clearly. Before I go further, I want to pause for a moment and ask you something directly, because this is where I find that many of my patients have what I call a personal reckoning. Take a moment right now and think honestly about your average day. How many hours are you spending seated? In a chair at the table, on the sofa watching television, in a car, at a desk? Most older adults who tally this up honestly are genuinely surprised by the number. For many people over 60 and 70, the total sits somewhere between 8 and 12 hours each day, sometimes more. If that number is uncomfortable for you, I want you to know that what I am about to explain about the solution is far simpler than most people expect. And the research shows that even modest changes produce real, measurable, biological benefits. But I also want to be honest with you because you deserve honesty from me. The research we have reviewed today is not suggesting that walking 30 minutes on Tuesday cancels out 10 hours of sitting on Wednesday. That is not how the biology works, and that is the part that most health messaging gets wrong. If you are watching this right now and you recognize yourself in what we are discussing, I want you to drop a comment below and let me know. Tell me how many hours a day you estimate you are currently sitting. You do not have to share anything personal, just a number. Because when I see how many people are in this situation, I want you to also see it, and I want you to understand that you are far from alone. What I have seen consistently in older adults is that the awareness alone, the moment when a patient truly understands the mechanism and the stakes, is often the turning point. It is the moment when change becomes not just possible, but genuinely motivated. Now, here is the part of the biological story that most people find the most surprising, and in many ways the most encouraging. At the cellular level, every cell in the human body contains structures called telomeres. Think of them as protective caps at the ends of chromosomes, similar to the plastic tips at the ends of shoelaces that prevent fraying. Each time a cell divides, telomeres shorten slightly. When telomeres become critically short, cells either stop dividing, a state called senescence, or they die. This is a normal part of aging. But when cellular aging becomes dysregulated, when telomere shortening accelerates, or when senescent cells accumulate in large numbers without being cleared, the consequences for cancer risk become measurable and serious. Senescent cells, despite no longer dividing themselves, release a cocktail of inflammatory molecules into the surrounding tissue. Researchers call this the senescence-associated secretory phenotype, or SASP. This secretion pattern actively promotes inflammation, disrupts normal tissue function, and creates an environment that makes it easier for neighboring cells with DNA damage to survive and proliferate rather than being eliminated. A 2021 study published in the journal Aging Cell found a direct correlation between accelerated telomere shortening and prolonged sedentary behavior in adults over 60. Participants who sat the most showed measurably shorter telomeres and higher SASP-related inflammatory markers compared to those with lower sedentary time, even within the same age group. This is the part of the conversation where the stakes become impossible to minimize. Because what the research is describing is not just a risk factor in the abstract sense. It is a biological aging process at the chromosomal level, accelerated by a daily behavior that most people consider completely neutral. The endothelial cells lining the blood vessels are also directly affected. Endothelial dysfunction, which refers to the impaired ability of blood vessel walls to regulate blood flow, prevent clotting, and manage inflammation, is consistently elevated in highly sedentary adults. Because tumors depend on the formation of new blood vessels to grow and spread, compromised endothelial health creates one more biological condition that works in cancer's favor. I want to make sure you stay with me for the next section, because what I am about to explain about the specific movement pattern the research identifies as most protective is both practical and immediately applicable. There is a widespread misunderstanding among older adults about what type of physical activity offers the strongest cancer protective benefit, and this misunderstanding causes many seniors to either overcomplicate the solution or conclude they are not physically capable of it. The research does not primarily point to vigorous exercise as the key protective mechanism against the sedentary cancer pathway we have been discussing. It points to frequent low-intensity movement distributed throughout the day. This distinction matters enormously. A 2023 meta-analysis published in the British Journal of Sports Medicine examined data from over 44,000 adults and found that breaking up prolonged sitting with short bouts of light physical activity, defined as 2 to 5 minutes of gentle movement every 45 to 60 minutes, produced measurable improvements in blood glucose regulation, inflammatory marker levels, and natural killer cell circulation. These benefits appeared consistently even in adults who were not otherwise engaging in structured exercise programs. The mechanism here is specific. Short movement breaks reload the large muscle groups, particularly the quadriceps and gluteal muscles of the legs and hips, which are the primary regulators of post-meal blood glucose and the primary drivers of lymphatic circulation. They restore circulation to the endothelium. They reactivate the vagal nerve pathways involved in immune regulation. All of this happens with something as simple as standing up, walking to another room, doing a brief set of gentle leg movements, or stepping outside for 2 minutes. What this means practically is that the most protective daily habit against the cancer pathway we have described is not a gym session. It is consistent interruption of sedentary periods throughout the day. It is a behavioral pattern, not a fitness program. And this is within reach for nearly every adult over 50, 60, 70, and beyond, including those with mobility limitations, joint pain, or chronic conditions. Let me give you a clear and practical framework based on what the current research supports, because what I want you to leave today's video with is not fear. I want you to leave with something you can actually begin today. The first and most important change is setting a movement interval. The research consistently supports breaking up sitting time every 45 to 60 minutes with a minimum of 2 to 3 minutes of gentle physical movement. This does not require equipment, a gym, or special clothing. It means standing up from where you are sitting right now, walking to the kitchen, stepping outside your front door briefly, doing a few standing calf raises, or moving through your home for 2 to 3 minutes before returning to what you were doing. The biological benefit of this simple pattern, practiced consistently, is measurable and real. The second change involves what you do after meals. Post-meal blood glucose spikes are one of the most direct triggers of the insulin and IGF-1 elevation we discussed earlier. A 2022 study published in Sports Medicine found that a 10-minute gentle walk taken within 30 minutes of eating a meal reduced post-meal blood glucose elevation by up to 28% compared to remaining seated after eating. For adults over 50, making this a consistent mealtime habit directly addresses one of the key biological pathways through which sedentary behavior promotes cancer-friendly internal conditions. The third change involves your longest sedentary period of the day, which for most seniors is evening television time. Research from the American Cancer Society identifies prolonged evening sitting as a particularly high-risk sedentary window because it typically follows the day's lowest movement period and coincides with overnight inflammatory processes. Breaking this window up with a 10 to 15-minute walk before or after the evening meal, or introducing standing periods during commercial breaks, meaningfully reduces the cumulative sedentary burden. There are also things to avoid. Avoid rationalizing that your morning walk covers the rest of the day's sitting. The research is clear that the mechanism at work here is about interruption frequency, not total exercise minutes. Avoid the belief that these changes are too small to matter. The biology disagrees with that belief strongly. If you have any existing medical conditions, joint problems, heart conditions, or balance concerns, please speak with your physician before beginning any new movement routine. What I am describing here is a general prevention framework based on population-level research, and your individual health history always matters. One more thing worth noting. Certain anti-inflammatory dietary choices work alongside movement to address the same cancer-protective biological pathways. Foods rich in polyphenols, such as berries, leafy green vegetables, olive oil, and green tea, have been shown in multiple studies to help lower CRP and other inflammatory markers, supporting the same biological environment that consistent movement creates. The combination of regular movement interruption and a diet that supports anti-inflammatory biology represents the most evidence-supported, accessible, and practical cancer prevention framework available to older adults today. I want to close today by being very direct with you because I think you deserve that. What we have covered today is not a simple fitness message. It is a window into a biological reality that affects every adult over 50, and the research behind it is among the most well-replicated in modern cancer science. Chronic low-grade inflammation, sedentary-driven immune suppression, disrupted gut microbiome health, accelerated cellular aging, and impaired endothelial function are not abstract risks. They are measurable, documented processes that are happening right now in the bodies of millions of older adults, most of whom have never been told the full picture. But here is what I most want you to take away from everything we have discussed. The same body that is vulnerable to this process is also capable of shifting course. The biological response to regular movement, even gentle and modest movement practiced consistently, is measurable within weeks. Inflammatory markers come down. Natural killer cell activity improves. Gut microbiome diversity increases. Blood glucose regulation stabilizes. These are not theoretical outcomes. They are documented in peer-reviewed research from institutions across the world. You do not need a perfect fitness routine. You do not need to be an athlete. You do not need expensive equipment or a structured program. What the research identifies as most protective is something you can begin doing today, right now, within the next hour. Stand up. Walk for 3 minutes. Set a reminder to do it again in 45 minutes. After your next meal, take a 10-minute walk. Those actions, practiced consistently, are addressing the exact biological pathway this research identifies as central to cancer development in older adults. Early awareness is everything in this conversation. The earlier you understand the mechanism, the earlier you can modify the behavior, and the earlier your body can begin moving back toward the biological environment that resists cancer rather than enables it. If today's video gave you something valuable, I want to ask you to share it with someone you care about, someone over 50 who may not know what we have discussed today. This is the kind of information that changes daily behavior, and changed daily behavior is what the research tells us actually matters. If you are not yet subscribed to this channel, please subscribe now. Every week, I bring you medically grounded, research-supported information specifically focused on the health challenges that matter most to adults over 50, 60, 70, and beyond. Information you deserve to have, explained in a way that is clear, honest, and immediately useful. This is Dr. Alan Mandell. Take care of yourself, take care of the people around you, and I will see you in the next video.